organ prolapse is the descent of pelvic organ or organs below their anatomical position. We have multiple organs within pelvic cavity, and here I have an illustration of the female anatomy. So you can see we have bladder, urethra, we have uterus and vaginal vault, we have rectum. So all of those organs have a potential to descend below the anatomical position. However, so those organs are supported within the pelvis via fascial connection to each other and via fascial and ligamentous connection to pelvic bones, and also they are supported by pelvic floor musculature on the bottom. So what's the cause of pelvic floor organ prolapse? So the cause is multifactorial. However, there are many risk factors such as pregnancy, vaginal delivery, increasing age, increased BMI, chronic coughing, chronic constipation, and repeated heavy lifting. So all those activities can be potential risk factors. There are different types of pelvic organ prolapse, and they are named after the organ which is descended. So here I want to show you. So for example, if we have a prolapse of the bladder, it will be named cystocele. Yeah, so that's their original position. So if there is a prolapse of the rectum, it's named rectocele. And here we see uterine prolapse right here. There are different stages of prolapse. They go from stage 0 to stage 4. With 0, there is no prolapse, it's a perfect anatomical position, and stage 4 is the most advanced when the organ descended below the pelvic cavity, and usually it will require surgical intervention. So what pelvic floor physical therapy can do and how it can help. So here at Inspira, we are focusing on education about general anatomy and what's happening within the body. We are focusing on educating patients about intra-abdominal pressure and what is it, and how poor management can contribute to progression of the prolapse. We also assess and teach how to connect to deep core muscles, how to connect to pelvic floor muscles, and we create a program to strengthen those muscles and work on endurance, so the patient can eventually perform their functional daily activities safely, confidently, without the fear that they can make things worse.